What happens in bone cancer research labs? Have you ever wondered what goes on in bone cancer research labs? These labs play a vital role in understanding and treating bone cancers. Their work can be divided into four main areas: diagnostic research, molecular and genetic studies, treatment development, and clinical trials. First, let's talk about diagnostic research. In these labs, scientists strive to improve how bone cancer is detected. They analyze tissue samples obtained through biopsies, which involve removing small pieces of bone or tumor tissue. Using microscopy, researchers look for cancer cells and apply molecular tests to identify specific changes in chromosomes or proteins linked to different types of bone cancer. They also study imaging techniques like X-rays, computed tomography scans, magnetic resonance imaging, and positron emission tomography scans. These advancements help doctors determine the type of cancer, its extent, and how far it has spread, which is crucial for planning effective treatment. Next, we have molecular and genetic studies. Researchers delve into the genetic mutations and molecular pathways that turn normal bone cells into cancerous ones. They analyze tumor DNA and ribonucleic acid to identify mutations and gene expression patterns. This research helps classify bone cancers more accurately and discover potential targets for new treatments. Understanding these molecular details is essential for developing therapies that can effectively combat the disease. Now, let's discuss treatment development. In this area, labs test new drugs, radiation techniques, and other therapies using preclinical models like cell cultures and animal studies. They evaluate how these treatments impact cancer cells, aiming to find options that are more effective and less toxic. Researchers also explore ways to overcome resistance to existing therapies, improving survival rates and quality of life for patients. Finally, we have clinical trials and the importance of participating in research. Research labs often collaborate with clinical teams to conduct clinical trials. These trials test new treatments or diagnostic methods in patients under controlled conditions. Patients with bone cancer may be invited to participate in these studies, which assess the safety and effectiveness of new approaches compared to standard care. This participation is crucial for advancing medical knowledge and developing future therapies. In summary, bone cancer research labs combine laboratory science with clinical research to enhance diagnosis, understand cancer biology, develop new treatments, and evaluate these advances in patient care. Their work is essential for improving outcomes for individuals affected by bone cancer. If you or someone you know is considering participation in research, it is always best to consult with healthcare professionals for personalized advice.